In this video, we're going to discuss the partial knee replacement. In order to understand what a partial knee replacement is, we first need to understand the different compartments of the knee. So we have the medial compartment on the inside of the knee and the lateral compartment on the outside of the knee. The medial and lateral compartment are formed by the articulation of the femur thigh bone on the tibia, the shin bone. The third compartment of the knee is the patellofemoral compartment, and that compartment is where the patella glides in what we call the trochlear groove of the femur. You can see that down here, the patella on the top, how it's gliding in that little groove on the femur. I also want to discuss with you the anatomy, right? The femur, your thigh bone, the tibia, your shin bone. The fibula is the bone on the outside of your tibia on the lateral side. We have all of our ligaments. We have our lateral collateral ligament on the lateral side. We have our medial collateral ligament on the medial side. So that's your LCL and your MCL. We have our anterior cruciate ligament and our posterior cruciate ligament, ACL and PCL. And then we have our meniscus, the lateral meniscus and the medial meniscus. So our ligaments are these tight bands that help stabilize the knee. And when we do a knee replacement, your ACL and a lot of times your PCL get cut out. But with a partial knee replacement, those ligaments stay. And that's one of the big fundamental differences between a full knee replacement and a partial knee replacement. Because that ACL and that PCL give you a sense of stability in the knee, and it also gives you proprioception. Now, proprioception is your body's ability to tell where the knee is in space. So if you move your hand up and down, your body knows proprioceptively. If you move it up, it knows that your hand is moved up. If you move it down, it knows that it's down. Your knee is a little bit different because as the knee bends, your body needs to know where it is in space. And so those ligaments actually give it that. And so when you try to, have a partial knee or have a knee replacement surgery and then go back to sporting activities, it can be difficult because you don't know where the knee is in space. It makes things a little more challenging. It can slow you down a little bit. This is another image just kind of really highlighting these different compartments. The lateral compartment on the outside, same side as your fibula. The medial compartment on the inside, and the patellofemoral compartment. So there are different treatments for different forms of arthritis. So if we have arthritis isolated only in the medial compartment, we can do a medial partial knee replacement. If we have arthritis located only in the outside of the knee, we can do a lateral partial knee replacement. And if we have arthritis located only in the trochlea or along the patella, we can do a patellofemoral replacement. This is another image depicting the three different types of partial knee replacements. We have medial on the inside, we have a lateral on the outside, we have a patellofemoral here in the middle. When most people tell you that they had a partial knee replacement, what they mean is they had a medial knee replacement right here. Right? That's 95, maybe even higher percentage than that of people with a partial knee replacement. These other two are far less common. Patellofemoral replacement is not a technically demanding surgery. It's not that difficult to do. The problem is it has a pretty high failure rate. Patients tend not to love the results. So you have to be incredibly selective about the patellofemoral replacement. This is something that surgeons should really only be doing, a couple or few a year. Lateral replacements are a technically demanding surgery, so they're more difficult to do. So the indications, there's actually a lot of people that would benefit from a lateral knee replacement. One of the issues is not many surgeons offer this surgery because it's difficult. It is not a surgery that I like to perform before I use the robot. But now that I am using robotic technology to do my knee replacements, a lateral compartment replacement is just as simple as a medial compartment replacement. It really doesn't change anything for me, and the results are just as good. So for me, I like to concentrate on medial compartment replacements, which are still the most common, and certainly offer lateral compartment replacements on people that would benefit from it. Patellofemoral, there are patients that do benefit from this surgery, and I absolutely do offer it and discuss the risks and benefits of it with them specifically. So when you look at the hardware for a partial knee replacement, it looks different. So here we have our full knee replacement. we have our femur condyles, both the medial and the lateral, and the tibia goes all the way across the bone. But a partial is different. It's much smaller, right? So the surface that gets cemented, it's a smaller surface. And that's one of the risks of a partial. Because there's less cement bonding the implant to the bone, there is a risk of it wearing out. Now, in the literature, partial knee replacements do just as well as full knee replacements. The number one risk for failure of a partial knee replacement is actually developing arthritis in the rest of the knee and just needing it converted to a total knee later. I want to show you a couple examples. So this is a patient that had isolated disease in their medial compartment. Their x-ray didn't look too bad. Their MRI really highlights it though. You can see the swollen bone, this white area on the femur. This was a painful total knee that failed conservative treatment such as injections, therapy, anti-inflammatory medications. So the rest of the knee was pristine. The lateral compartment and the patellofemoral compartment looked perfect on the MRI. So what did we do for this patient? We did a partial knee replacement, a medial partial knee replacement. So on the inside, we just replaced it. So you resurface the tibia, you resurface the medial femur, and there's a piece of plastic that goes in between. That's that white piece right here. So that's the front view, and here's the side view. And that's a perfect looking medial partial knee replacement. Here's a patient with isolated disease on the outside of the knee or the lateral compartment. This is a valgus knee. The inside of the knee looks pretty good, and the patellofemoral compartment was also in good shape. So what do we do for this patient? We do a lateral partial knee replacement. So we can see here the lateral side with the fibula. The lateral knee, we have the tibia component, and we have the femur component. Here's the side view showing it. So we just replaced the lateral side. So patellofemoral replacements are by far the least common of all the partial knee replacements. When you have isolated disease in just the trochlea and just the patella, you're a candidate for this. The problem is most people with disease here also have some degree of arthritis either on the inside or the outside of the knee, and they're usually a better candidate for a full knee. So you have to be incredibly selective about this surgery. Otherwise, the failure rate is significant. And if you do have isolated disease, you are a candidate. So what do we do in this surgery? Well, just like in a full knee replacement, we do resurface the patella. That doesn't mean we cut the patella out. It means we shave a small amount off of it and cement a piece of plastic onto it. So you can't even see the plastic because it doesn't show up on an x-ray. And then we resurface the femur where it glides. So you remember back here, this image back here, right? This is where the patella glides, in that groove right here. So we are resurfacing that area right there and putting metal on it so that plastic can glide on it and doesn't cause you any pain. You can see here, this is what we call a sunrise view, right? Because it looks like the patella is the sun rising. But this is a view of the patella and how it glides in that groove. And that plastic piece fits perfectly in that little groove. So that's what we want a patellofemoral replacement to look like. So this is what the partial knee is. There's the medial, the lateral, and the patellofemoral, and that's the difference between the three. I hope this video has been beneficial.